Hi, very good evening. I'm sorry for the delay in the live session, first of all. I'm still wondering why you're all awake. So maybe you're preparing so extensively that you're not sleeping, which is both a good as well as bad sign. So how are you doing? So first of all, New Year. This is our first live session. Wish you all a happy New Year. Yes, good morning. Good morning, everyone. Hi Abhishek, Shivaranjani, Thanu, Bernice. Surprising. I know you must be cursing me, right? Hi Nikarika. Hi Neetu, Shruti, Preeti. Hi. Hi Tabish. Hi Nature Lover. Yes, Ananya, Brijesh. Hi. Hi Rohit. Lopamudra, Judge, Ananya. Yes. Paritosh. Hi. Happy New Year. Right, so today we'll focus on a few key points, right? And then it will be a mix of basics as well as clinicals, right? We'll do it for around 20 to 30 minutes and then we'll come up with more and more discussions in the coming days, right? As many as possible. Fine? Hi Madhumita, thank you so much. Yeah, Happy New Year. Okay, fine. So, we'll start with some basic subjects, right? So, first of all, can you name the unpaid bones of skull? Unpaid bones of skull. Or to be more precise, unpaid bones of facial skeleton. Yes, good. Obviously, one is mandible. What could be the other bone? Unpaid bones of facial skeleton. So obviously we have this mandible, right? Yes, frontal. We have this metotic suture which gets closed after 1.5 to 2 years, right? Yeah. So we can't say occipital here. We're talking about facial skeleton. Yes. So as Ananya rightly said. Okay, okay, Preeti. I'm really sorry to disturb everyone's sleep. We'll do it for just 15-20 minutes max, right? Yeah. Hi, Prashanti. So maxilla, I guess, paid. Okay. Mandible and omer, isn't it? So the facial skeleton, right? So mandible and omer. So frontal bone, occipital, they all come under part of your capping of your skull, isn't it? Skull cap. They're the bones of your skull cap. So of facial skeleton, so we have mandible and omer. So frontal, occipital, what you said, they will be coming under the skeletal bones of your cranial vault, right? Okay, fine. Now let's move on to the next one. So how many bones does the skull contain in total? The total number of bones in skull and calvaria and facial skeleton. Yes, good. 14 plus 8. So 14, the facial skeleton 8, the calvary. So total 22 bones, isn't it? Good. So what is pterion? P-T-E-R-A-O-N. Yes, so calvary 8 bones, facial 14 bones. Good. So what is pterion? No, it's an anatomic landmark. We have pterion and asterion, if you remember. Yes, sure, Anjani, Dhanapriya, Neetu. Yes, it's a butterfly-shaped or head-shaped structure. Good. Yeah, formed by union of parietal, temporal, frontal, sphenoid. Very good. So pterion is a head-shaped structure where frontal, parietal, sphenoid and temporal bones meet. It's considered to be the weakest point. Right? Frontal, parietal, sphenoid and temporal bones. Right? Union of 4 bones. Good. Okay. And which one do you think or consider the largest foramen in skull? Name the largest foramen of skull. Yes. So obviously it has to be foramen magnum, right? Okay. Good. Which is considered to be the largest and strongest bone of skull? Largest and strongest bone of face, in fact. Which bone is considered to be largest and strongest in face? Okay. Yes, mandible is considered to be the largest and strongest bone of facial skeleton. What is the function of buccal pad of fat in case of infants? Hi Farheen. What is the function of buccal pad of fat? Priya, it's mandible, okay? Yeah. Purpose of buccal pad of fat in case of infants. Good. Helps in suckling. And you might have heard of, okay, yeah, reservoir of energy. Yes, Shivani, in fact, we can consider that obviously as a source of your reserved energy. Good. You might have heard of lumbar puncture. We have discussed the sequence of various tissues which we come across while proceeding with lumbar puncture, while collecting CSF. So, where is lumbar puncture performed? Between which vertebrae is lumbar puncture usually performed? Yes. Good. At or below the level of L3 and L4. Good. Right. Yes, it can be at or below the level of L3 and L4. Name the foramen through which facial nerve exits from the skull. Or facial nerve exits the skull through which foramen? Yes, you did not really worry even if you can't recollect. So this is just for sake of revision, right? Actually, this is not a test for you. This we are doing for sake of revising as many key points as possible. Just to brush up of our basics. Good. It is. Hi, Ravi. Hi. Yes, it is stylomastoid foramen. Good. What is the approximate length of larynx? So these are all purely memory based. Approximate length of larynx. Hi Kushbu. So you can either guess or you can either Google and give me the answer. Yes, approximately 36 to 46. Can you tell me the units? (36 to 46). Yes, Priya, mango. Shivaranjani, you say centimeters, so equivalent to that of a long scale. Larynx is a very short tube. Okay, 36 to 46. mm. It's millimeters, right? Okay. So we have already discussed this specific topic in our e-classes. What is Kieselbach's plexus? Kieselbach's area or Kieselbach's plexus? And what is it also called as? Good. Yes, place where four arteries join, Little's area. Common tendency for bleeding, nosebleed because of this Little's area, right? Yeah, good. So it's an anastomosis of superior labial branch of facial artery, sphenopalatine artery, and along with that, large capillary network, right? You can refer to our previous E-classes video for more information. Yes, it's prone for bleeding. Good. Fine. So what are the various structures or sinuses opening in middle meatus? So we have discussed this in detail as well. So what are the various structures or sinuses which open into middle meatus? Yes, obviously maxillary sinus, ethmoidal, good, anterior and posterior, right? Yes, with the ethmoidal sinus, yeah, maxillary sinus and yes, in hiatus seminilaris, and also have this frontal ethmoidal recess, right? Frontal sinus, good. So some sinuses opening in your middle meatus, right? So make sure that you go through those images as well. If you remember in TMJ we have various ligaments, right? So what is the other name for lateral ligament? What is the other name for lateral ligament? Yes, with the Spinomandibular is an accessory ligament. Yes, lateral ligament is also called as temporomandibular ligament. Good. Yes, so previously I asked you what is the length of larynx. So what is the length of, approximate length of esophagus? Yes, good. So we have a very wide range, starting from 10 centimeters to maximum of 55 centimeters. Yes. So the length of esophagus. Okay. Okay, how many of you Google before answering? Yes, now I'll be getting the right answers. Yeah, approximately 25 centimeters. Good. temporomandibular ligament, Shivani. A lateral ligament is also called as temporomandibular ligament. Okay, now since we have covered trachea and esophagus, why leave? Since we have covered larynx and esophagus, why leave trachea? So, what would be the approximate length of trachea, windpipe? Yes, Brijesh, Lopamudra, Yash. Yes, Vidhi, Jackson, Banavatu. Yes, Preeti, Aman. Good. So it is 15 centimeters, right? So you can just make a note of these values and see if you can by heart or revise these values again before exam. It will be easy for you and you will obviously have more confidence, right? Yeah. Which is considered to be, see, if you know that external carotid artery has a certain number of branches. So how many number of branches do you see from external carotid artery? Wow, 9, 8 and 7. Okay, 4. So it seems that I am getting some kind of phone number. Yes, it is 8 number of branches from external carotid. 8 branches, very important. And of these 8 branches, which is considered to be the largest terminal branch? Yes, the 8 branches of external carotid. Superior thyroid, ascending pharyngeal, lingual artery, facial artery, occipital, posterior auricular, maxillary, superficial, temporal. So the 8 terminal branches, 8 branches of your external carotid. Of these, which is considered to be the largest terminal branch? Good. It is maxillary branch. The maxillary branch is considered to be the largest terminal branch. And if you remember, we have 3 parts. The maxillary artery is divided into 3 parts by a muscle. So name the muscle which divides maxillary artery into 3 parts. Yes, Ravi, good. Salfopmus, SALFOPMS, yes. So we have different ways of remembering it. Yes, Bernice, definitely. So name the muscle which divides the the maxillary artery into 3 parts. So you have superior thyroid, ascending pharyngeal, lingual artery, facial, occipital, posterior auricular, maxillary, and superficial temporal. Right? I hope it's clear, Bernice. Yeah. So lateral pterygoid divides this maxillary into three branches, right? So you can remember it as S A L F O P M S. So the same thing I'll try to put down here. So as Ravi rightly mentioned, so this is one way of remembering, right? You can frame your own mnemonic accordingly. Okay, fine. Okay, this might be a bit difficult for you, but anyways, let's try. Name the nerve. Okay. Yeah, name the nerve which accompanies the third part of maxillary artery. A related question. Name the nerve which accompanies the third part of maxillary artery. Okay, Abhishek. Yes, yes, Preeti. Good. The second part supplies for also mastication. Okay. Someone has given us some mnemonics. First part, Damai, Pigpass, DPMP. I don't know what the code stands for. Okay, fine. Yes, it is infraorbital nerve. Infraorbital nerve accompanies the third part of maxillary artery. Okay. You have these muscles of eye, right? Lateral rectus, medial rectus, superior oblique, inferior oblique. So all these muscles are supplied by which nerve? And also we have few exceptions. And name those exceptions. Yes, oculomotor, right? So yes, Prashanti, good. Yes, Niharika. Yes, Aman, I got it. Thank you. Someone has given us a few mnemonics for maxillary artery branches. You can go through them. Yeah. So all muscles of eye, oculomotor, except we have this SO4 and LR6, right? Good. The superior oblique by trochlea, lateral rectus by abducens. Good. Okay. So name the foramen through which middle meningeal artery enters the skull. Yes, Abhishek. Yes, Niharika, Preeti, Neetu, Madhumita, right. So name the foramen through which middle meningeal artery enters the brain, the cranium, or the middle cranial fossa. Okay, good. It is spinosum, right? Foramen spinosum. Fine. So, are you doing fine? Is it fine if I continue, or do you want me to stop? It's already 1:06 a.m. Okay. Yes, Prithvi, I'm sorry. I'm sorry for the delay. In fact, I was not feeling well. So, a lot of stress. I don't know when I slept, but I slept, so I woke up late. So, immediately I didn't want to cancel the session. Yes, yes, I'll definitely continue. Yes, Paritosh, you're sleeping. Right, good night. Fine, so we'll just continue with few more points. Okay. You can't sleep. It's a very bad sign. You should sleep. You should sleep. Right. We'll do it for another 10-15 minutes max, right? Okay. Okay. One simple question. Like when you're carving permanent teeth, you have certain specifications like dimensions, etc. Right? So who gave these specifications? Name the scientist who has given these specifications for carving your permanent dentition. Yes, Anugya, definitely. Najrin gives us a smart answer. You mean to say it's wheelless? Okay. Okay, fine. GV Black. GV Black has given specifications for carving individual permanent teeth. That's fine. Okay. So what is the average time period taken by each permanent tooth to completely form? The average time duration which a permanent tooth takes to completely form. Okay, tell me the entire tooth. It can be the crown and root combination. Yeah, hi Deepthi. Yes, you're closer. Yes, Sirisha. Hi, Sirisha. Yes, it's around 8 years. Yes, around 8 years. Right. Good, you're close. So if I ask you what is the... Okay, tell me different functions of pulp. We have one continuation question for this. What are the various functions of pulp? Yes, defensive, nutritive. Yes. Sensory, good. Protection. Yes, I was waiting for the answer. Formative. Yes, Brijesh. J. Lakshmi. Yes. Yes, Manal. Hi. Hi, Darshak. Okay. Anyways, okay, I've been calling few of you today. Vijay Lakshmi, I called you, but I couldn't get any reply, even from Prithvi. Right, anyways, I'll try calling you people again tomorrow, right? Yeah. Yes, Manal, do you say proprioceptive? Okay, good. So we have different functions, as you all rightly said. Which one do you think, or which one do you consider as the primary function of pulp, of all this? Yes, Prithvi. By the time I saw your mail, I just woke up. That's around 12 o'clock. So we'll definitely speak tomorrow, right? Yeah. Yes, good. So which one do you think is the main function of pulp? Very good. So formative function is considered to be the main function, right? Yeah. So when do you see a root resorption in case of deciduous teeth? After completion of a root formation, after how much time do you see root resorption approximately? Yes. So once a root is completely formed, after how many years do you see root resorption? It's not really immediately good. Anyways, it's around 1 to 2 years. So after root formation, approximately after 1 to 2 years, you start seeing this root resorption. Fine. So when you compare the direction of enamel rods at the gingival area in primary versus permanent teeth, when you compare the direction of gingival rods or enamel rods as such in gingival area in primary and permanent teeth, what difference do you find? So for example, if I say gingival rods are inclined in one specific direction at gingival area, I'm sorry, did I say gingival rods? I'm sorry, enamel rods. We're talking about enamel rods. If I say enamel rods are oriented in a specific direction in gingival area or cervical area of primary teeth, so in what way is that orientation different from that of permanent teeth? Good. Yes, Vidhi. Yes. So, in case of primary teeth, well, as you rightly said, they are directed occlusally, whereas in case of your permanent, they are directed towards your gingival area, right? That's the reason why we go for gingival bevel placement, isn't it? In case of permanent teeth, when you're going for class 2. Good. Impressive. Okay, one standard question, but often we go, we often commit errors in this. So, which cusp do you think is the largest cusp in case of maxillary first permanent molar? And also tell me the sequence of various cusp sizes in the same tooth. Maxillary first permanent molar, largest to smallest cusp. Yeah, if you're giving me the sequence, try to give the sequence in the same comment, right? Yes, as you all rightly said, mesopalatal is considered to be the largest cusp, obviously. Very good. Yes, Bernice. Yes, Preeti. That's my favorite way of remembering. It's in jet direction. You start from mesopalatal, right? And then mesobuccal, distopalatal, distobuccal. So assume that this is your mesial side and that's the distal side on occlusal surface. So starting from mesopalatal, mesobuccal, distopalatal and distobuccal. So jet-shaped or N direction, whatever it is. So this is the way in which you can remember, right? Already we had one picture-based question on the same, right? Yeah. So this is according to your Wheelers, right? Yeah. But if you look at the cusps in a model or in case of your extractive, we often think the other way. Anyways, just go as per the information given in your Wheelers, right? Yes, Preeti. Yeah. Good, Vidhi. Yes, Abhishek. Yes, Preeti. Bingo. Mm. One of you asked me a question recently in one of the mails. Where do you mails? I'm talking about mails, okay? Where do you find this tritubercular molars? Tritubercular molars are seen in which animals? Good. It is dogs. Quadritubercular in case of humans, right? Good. So name the primary tooth which resembles permanent maxillary first molar. Name the primary tooth that resembles permanent maxillary first molar. Yes, so it's primary maxillary, second molar. Very good. And also name the tooth. Name the primary tooth which exhibits cusp of Carotid. Name the deciduous tooth which exhibits this cusp of Carotid. It's again the same. Primary maxillary, second molar. In fact, first molars, deciduous do not resemble any teeth, isn't it? Yeah. Good. Right. Now, if I ask you which anterior tooth has widest or greatest mesodistal width, can be primary or permanent, which anterior tooth has greatest mesodistal width? So to clarify, the tooth, deciduous tooth which resembles permanent first maxillary molar is your primary second molar, and again the deciduous tooth exhibiting cusp of Carotid is the same, right? The second primary maxillary molar. Yeah, obviously central incisors have greatest mesodistal diameter. Good. Name the only tooth which is wider palatally or lingually compare to the buccal aspect. So name the tooth which is wider lingually than buccally in terms of mesodistal dimensions. We also discussed the same while going through embraged spaces, if you remember. Good, it's maxillary first molar, right? Yeah. Okay, again some numericals. What would be the maximum opening movement of a team, or what could be the maximum opening of your mouth if I ask you to give a range? Maximum mouth opening. Yes, someone. Very good. That's the reason why lingual embrasures are larger. Good. That's a point which we discussed previously also. Good. Maximum mouth opening. Okay. It varies, but it can be given a range. We can assume that to be 50 to 60 centimeters. Is it centimeters or millimeters? Okay. While answering, once I have by mistake mentioned that as centimeters during my UG. Okay, good. What could be the maximum protrusive movement? Protrusive movement of a mandible. What could be the maximum protrusive movement? Yes, Vijay Lakshmi, you're right. Good. It's around 8 to 11 millimeters. Yeah, 8 to 11 protrusive movements, right? Maximum lateral opening. Maximum lateral opening of 10 to 12 millimeters. When you compare the mesial aspect of maxillary and maxillary first and second premolar, when you try to compare the mesial aspect of maxillary first and second premolar, what is the distinguishing feature? Good, Aryan. You see fluting, depression. Fantastic. Concavity, marginal groove. Yes, in case of first premolar, we have mesial marginal developmental groove. Good. So what is the other name for maxillary sinus? Yes, Preeti. For him, Prithvi, Tanu. Yes, also in terms of mesial slope. We talk about these slopes when you're having this buccal or labial view, isn't it? Even that's very important. Antrum is any sinus, any air-filled sinus, we call it as antrum. Uh, Shruti. Yes, Schneider. Yes, Abhishwar, Hin, Ashrin, Prithvi. Aryan. Yes, antrum of Highmore. Good. And what is the lining epithelium of maxillary sinus? Yes, very good. Alankrita. It's Schneiderian membrane or wow. So Najrin, you're trying to save your energy by giving short forms. Yes, pseudostratified ciliated columnar epithelium. Schneiderian membrane. Very good. And also regarding the time durations, first evidence of calcification, enamel completion, see if you can revise all these values just before exam, right? Okay. Which one do you think is the largest or longest? Okay, we'll start with this. Which one do you think is the longest tooth in the mouth? Longest tooth in the mouth. Now the question is it maxillary canine or mandibular canine? Okay, smart people are answering it as canine, which is good, impressive. Now, is it maxillary canine or mandibular canine? So Aryan is giving us the dimensions also, which is impressive. Exactly. Good, Prashanti. It's both. Both are same, but what do they differ in? Maxillary and mandibular canine, both combined crown and root lengths are same, but where do you see the difference in? Is it in the crown length or root length or both? Good, it's both crown and root, obviously. One varies, the other changes, right? So, where do you see longer crown comparatively, maxillary or mandibular? And where do you see longer root? Oh my god, you're just confusing me. As far as I remember, the length of crown is 1 mm longer in case of mandible. So we have longer crown length in mandible, longer root length in maxilla. Please do correct me if I'm wrong. As far as I remember, the crown length is 1 mm longer in mandibular canine than maxillary. So longer root, obviously in maxillary canine. I hope I'm right. Yeah. Okay. So a final one, right? So before concluding, it's already 1:30. Hi Manasi. Where do you see prominent cervical ridges? Prominent cervical ridge. Yes, someone. Brijesh, thank you. Okay. A very smart answer, Prithvi. Which primary teeth? Or which primary tooth? Yes, when you compare primary permanent, prominent cervical ridges are seen in primary. So which primary tooth do you find? Prominent cervical ridges. Lower first molar, deciduous. Lower deciduous first molar. Mandibular first molar, right? Yeah. You might have even carved it, right? We will place a prominent cervical ridge, doesn't resemble any tooth whatsoever. Okay, fine. So as I keep on continuing, the number of people watching live seems to be increasing, but I'm sorry I can't continue any further. It's already 1 hour approximately and it's 1:30. This is not really my favorite time, but this seems to be your most favorite time. If I say, shall I continue the same every day? A few of you are going to curse me, right? So what shall we do? We'll stop it here. So from tomorrow, shall we have the same or shall we have it at 9 p.m., 8, 9 p.m. as usual? In fact, I'm trying to do more and more live sessions covering these key points as many as possible, right? So you have any suggestions, you can drop them to my mail or you can even drop a message in our group, WhatsApp group, right? Now the debate continues, right? We want live sessions now. Few of you are totally against it. Yes, I do understand. Okay. Yes, Vipin. Yes, Arjun, I would love to ask few more questions, but we'll definitely do it. Yes, we'll definitely do it, right? We'll do these sessions even tomorrow, right? I'll come up with timetable, right? Yes, you can drop a mail at proudtobedentist@gmail.com, right? Yes, Teju, I too love you. Yeah, drop a mail and yeah, we'll see you again tomorrow, right? So tomorrow evening we'll try to have multiple sessions at different time schedules, right? So you can join as per your convenience. Fine. So in fact, I haven't had my dinner and I'm starting having this leg pain. So I'm sorry I can't further continue, right? Yeah. No, Priya, I'll be doing it in cumulative fashion, no specific topic, right? We have been doing specific topics for the past 1.5 months. Till 1.5 months, we have been doing the same, but for the past 1 month, we have been doing it cumulative. So we'll try to cover as many key points as possible in cumulative fashion, right? So today we have covered a few in anatomy and dental anatomy and oral histology. So tomorrow, day after tomorrow, in the coming 3 days, we'll do as many live sessions as possible, right? Yeah. Yes, WhatsApp group is saturated. You can join our Google group or you can even join our study club. Fine? Yeah. I'm really sorry. I know you are very enthusiastic and you are eagerly waiting. I promise you will do more of these sessions, right? Yeah, we'll have multiple sessions from tomorrow. Yes. You're all welcome. Good night. So try wake up at least by 7 and then proceed with your preparation, right? Yeah. And also I've been calling each one of you individually, so I'll try to cover a few more calls tomorrow, right? And it was always great interacting with you all. So good night. Love you all. Right? Take care. Yes, Deepthi, good night. Yes, I'm glad to hear that. Yeah. Yeah. By the way, Happy New Year. Okay, bye. Love you all.